Being school-based is really important because I'm visible in school. I look very different to a teacher. I wear a school nurse's uniform. When I walk around the corridor, young people do approach me and say, "Oh, hi miss, can I come and see you today?" So I feel really privileged to be based in school and to be working with young people. I think to have that trust with young people and for them to be able to come to me when they've got a problem or a concern, and to have that is a really special relationship. And you do get to know the young people really well in my job, and you get to know their families really well, and you work very closely with them. And it's really nice to have that trust with them and to be able to support them in the way that they need to be supported with their health. So my role as school health advisor at Manchester Health Academy is quite wide and varied. A big part of our role is early intervention and prevention, so we do a lot of public health work. So that can look like anything from sort of smoking cessation work, looking at preventing obesity. It can be around a safeguarding curriculum, so it can look at healthy relationships. It can be looking at puberty, sort of sex and relationship issues. So we do a lot of classroom-based work in terms of the public health agenda. The other part of my role is seeing young people within school. Young people can refer themselves to me directly, so they will just pop into my room and say, "Anna, can I speak to you please?" Or the school staff can refer them to me as well. So I will spend quite a lot of my time seeing young people, and that can be about a number of health conditions really. I do a lot of emotional health work, giving them some skills and some tools that they can use to support themselves with their emotional health, but also making sure that they get to the right place. So if they need any further referrals with their emotional health, that could be looking at referring them to 42nd Street or looking at the Child and Adolescent Mental Health Service for them. So just making sure that they get the support that they need to be as healthy as possible really. Long-term health conditions as well, so looking at young people that have asthma, epilepsy, diabetes, making sure we work with them to make sure they're as supported in school as possible with those long-term conditions, putting a care plan in place so that school are really clear about what their role is if they do have any problems with their health in school, working with the families to make sure that we're doing everything that we need to be doing to support them. So it's really wide and varied, covering quite a large breadth of health really, but it's just to ensure that they are as healthy as possible and we can intervene early with their health concerns and get them to where they need to be with their health and make those referrals that are really important. So another aspect of my role is Chat Health Lead. Chat Health is a text messaging service which young people can use to text into the school health service for help and support with their health needs. So any high school age child can access the service and they can send a text in from their mobile device to the school health service. We have one school nurse on duty per day who receives the messages from all over Manchester. It's a confidential service as well, so that information routinely just stays between the young person and the school nurse. They can text in anonymously as well, which we know young people really like. They can also end up having a school nurse appointment through Chat Health, so we'll quite often receive a text message and we'll think, actually it would be quite beneficial for you to sit down with your school nurse so we can explore those health needs further. We've had lots of positive feedback about Chat Health and young people seem to really like it and use it well, which is really beneficial for them. So I think school nursing improves health outcomes because we are delivering early intervention and prevention work, looking very much at the public health agenda, which I think does help the NHS a lot because we want to prevent health concerns escalating, and that's quite a unique position to be able to do that. It's a really positive thing. It's a lovely role to be involved in, and if you do want to work closely with young people, with children, with their families and work with education in order to improve health outcomes, it's a brilliant job, it's a fantastic job.